this community, as hard as some of this stuff might be, they smile and they find joy and they find connection and they persevere.
If you're listening to this episode, you've probably experienced the isolation and confusion that comes with a PSP, CBD, or MSA diagnosis. The frustration of being met with blank stares when describing these diseases to other people, including sometimes your own doctor. But today, I'm talking to a group of people who truly get it. I'm joined by my colleagues, the entire patient care partner and advocacy team at CurePSP, Jessica, Courtney, Kelsey, and Joanna, the voices on the other end of the phone when you call with questions, the team creating the resources with invaluable information, and the advocates leading strategy for our efforts on Capitol Hill. The PCA team knows how great it would be if there was a famous face that people could connect to at least one of these rare diseases. But in the absence of that, they are prioritizing something much more sustainable. Genuine community connections so that no one is on this journey alone. We'll talk about why finding others who speak this unique language can be life-changing, how support groups have evolved into hubs of both emotional support and practical medical education, and how an emerging approach to care that focuses on dignity and quality of life could help change outcomes. You'll learn about who exactly this grassroots team is and the programs they've built that are reducing stigma, providing relief, and honoring resilient spirits. If we all want to go around and just give a little background on who you are and your role at CurePSP.
Thanks so much for having us on, Oscar. I'm Jessica Shore. I am the Director of Clinical Affairs and Advocacy here at CurePSP. I'm a clinical social worker by background, so I worked as a LCSW at a Movement Disorders Center at UNC Chapel Hill for almost 10 years before joining the team at CurePSP almost 4 years ago. And I have the privilege of working with the patient and care partner advocacy team here. Courtney, I will pass it to you to introduce yourself.
Hello, my name is Courtney Malberg. I am the Associate Director of Education here at CurePSP. I joined the team back in February of 2024, coming from 4 years of Parkinson's disease education. I have a social work background and additionally an advanced graduate certificate in public policy and public administration. Joanna.
My name is Joanna Teeters. I am the manager of the Quality of Life Respite Grant Program here at CurePSP. I joined the team in April 2016 as the office manager and have worn many hats through those 9+ years at CurePSP, but always working closest with the patient and care partner advocacy department, and really have enjoyed my time here with the team and, having the opportunity to work really closely with this very special community. I landed here completely by accident. Almost 10 years ago. I have my degree from Berklee College of Music, and those who know me know that I am a performer and a singer and songwriter when I'm not at CurePSP. So that's a little bit about me.
Hi, my name is Kelsey Woods, and I am the Support Programs Manager. I joined the CurePSP team back in May of 2019, so have recently celebrated my 6-year anniversary and have been so grateful to be a part of the Patient and Care Partner Advocacy Department for most of that time as well, splitting a little bit of my beginning times with event coordination, and then really found that I love talking to the community of people diagnosed, care partners, families, and of course our volunteer network of support group leaders and peer supporters. So very happy to be a part of the team, and thanks for having us, Oscar.
Kelsey, I'm curious, what would you say PCA's function is for the CurePSP community?
Yeah, a lot of what we do is really relating to our community in various different forms, whether that be through centers of care, support groups, or our online educational programs or in-person educational programs. And of course, providing what we think they need, but then also getting that feedback from what they want to hear. And it really spans across a lot of different avenues, whether it's information right at the beginning of diagnosis of what are the symptoms I should expect, what stage might I be in, all the way up through, I'm having these feelings of grief or anticipatory grief, which we recently had a wonderful webinar on, up into the brain donation process. So really spanning our education programs and support systems and strengthening them for our community.
Jessica, how would you say that supporting people with PSP, CBD, and MSA differs from, bigger, more well-known neurological conditions?
It's a really good question. I think that the very lengthy diagnostic odyssey that many folks go through, it can take months or years from the time that initial symptoms present to getting to the place of getting the right information and answers and diagnosis. And then once they arrive at a diagnosis of something like progressive supranuclear palsy, they're given a diagnosis that likely they have never heard of before. So I think that because of all of that, we at CurePSP and in the resources and programs we create, we play a really important role in not just normalizing and validating these kinds of lived experiences that are unique with our community, but also honoring them through things like building sense of community, providing the right education, taking actionable steps, and really trying to be a voice on behalf of our community and empowering our community to use their own voice.
Yeah, in the absence of, an identifiable figure, just being able to talk about it and someone understanding what you mean. You kind of mentioned community, connecting them with others who have had a similar experience. What have you found? Like, why is that so important? Why is community so important?
It reduces sense of isolation. It can feel really lonely to live with something that you're not sharing with other people or that you feel like other people don't understand, especially when it's something that perhaps is more stigmatized. This is a soapbox, but we live in a very ageist and ableist society. And so a lot of times we don't talk about the medical conditions that we live with because we're afraid that people are going to treat us differently or view us differently. And I think that's even more the case when someone has something that progresses quickly or that no one's ever heard of or that makes them physically look different or speak different or be slower or move differently. And I think that can be really lonely. And so there's so much validation and empowerment in finding other people who get it. A lot of times people are kind of hesitant to try a support group because it's a different kind of forum and interaction than they might have had before. But 99.9% of the time, once someone goes to a support group or connects with a peer supporter or comes to one of our educational programs, I see this little light bulb go off in them of like, oh, there are other people in this world who have walked this path before me or are walking it alongside of me and understand the language that I am speaking right now or these challenges that I have been faced with.
I totally second what you're saying, Jessica. Yeah, I think the knowing you're not alone is essentially what I try and relay to people when I'm suggesting a support group. Also that, of course, there's this touchy-feely side of support groups, which is really wonderful and what they're there for and a piece of it, but it can also be the most educational place to go to learn about new assistive devices and potential clinical trials or even a medication. That of course we always recommend you go back to your doctor to try, but it could spark a light bulb in someone of I hadn't yet gotten into physical therapy. Of course, let me now go ask for that, or let me ask for a referral to a social worker. So those groups have so many benefits to them, and of course, providing community is such a great piece of it.
Yeah, Kelsey, how does CurePSP actually hear from community members? What are your ways of understanding what people are looking for and what resources they need?
Yeah, as I mentioned, a few different ways. So I jotted a couple notes down because they really come in from many different avenues. One of them, of course, is social media. And I know that the marketing team really handles that aspect of it. But then there's also phone calls. People are calling every day, whether it's a healthcare professional, a person newly diagnosed, a person towards the end of their journey, a sister, a friend, a parent, a child, everyone's calling and asking questions, and that's how we understand what are the most frequently asked questions from the community. I also oversee the info at CurePSP.org, and that's a really wonderful way to hear what the community is looking for. Some general questions there, but that is what people are asking for. What can CurePSP do for me? What are my symptoms? What about this specific symptom can be done? We also send out surveys frequently, really across the whole gambit of access to care, asking people about our support group, feedback, asking people about our support group feedback, and really getting us outreaching to the community to see what they are looking for. And yeah. And of course, through support groups. I join support groups myself, and our support group leaders are always coming back to us to let us know what the community is looking for.
Yeah, and when someone comes to you looking for help, are there any common issues that you feel that CurePSP can help supporting?
Absolutely. A lot of them have to do with symptom management. And so what's been wonderful with our Ask the Expert webinars is that we really do focus on specific either symptoms or topics, whether it's swallowing or gait and balance issues. So we have a very tangible resource to be able to say, here, I can send you this link on this topic. Or you're welcome to go to the wonderful CurePSP TV YouTube page and see for yourself the truly hundreds of videos that we have on many different topics. Also, people are usually interested in the scope of the diagnosis. They've maybe been searching for answers for 1, 2, 3+ years to really get an answer of what's going on. Once that doctor gives them the diagnosis, they may provide a few resources, hopefully refer them to CurePSP, but sometimes kind of left in the dark and wondering, I've never even heard of this diagnosis. I feel alone. And so then they come to us.
Yeah, and you listed they're looking for, symptomatic management. They're looking for information about the scope of the disease. They're looking for any sort of educational resources that might be able to help. They're looking to access community. I'm looking to join a support group because I feel like I could really use some help and hearing from other people and how they're dealing with an issue at hand. And oftentimes they're looking for some sort of financial assistance. Because there can be a lot of costly factors to a diagnosis like this, and a nonprofit like CurePSP is committed to helping to ease that burden in myriad different ways. And of course, information about research and what's being done and clinical trials. And so we do our very best to make everything, under the sun about most frequently asked questions regarding a PSP, CBD, or MSA diagnosis really accessible, easily accessible. We know that our community has a lot on their plate. And so I think we work really hard to make sure that we're offering easy to understand information about some of the most frequently asked questions so that people can take the information that they're looking for and run with it without too much hang up.
I want to get into some specifics about each of your roles because you all do very important and specific things. Courtney, coming from a large organization like the Parkinson's Foundation, how would you say that the CurePSP network compares to that?
Oh, that's a tough question. I think Jessica spoke on this earlier, but the needs of people with PSP, CBD, and MSA are just so different from that of Parkinson's, and they're so much more rare and underdiagnosed and misdiagnosed. And so I think the community feels so much more connected to each other because they've had this really similar, unique, and sometimes devastating experience. And I think that because of that, that's what makes CurePSP so unique. Although it is so much smaller, we get to interact with the community members on a level that I hadn't previously got to experience per se, which helps just educate me on what information people want, to Kelsey and Joanna's point.
I think with that, there's a lot of opportunities for partnership with other, with sister organizations and with larger organizations too. Like with Parkinson's disease, we don't want to get lost we don't want our diseases to get lost in the Parkinson's community because they often do, shuffled into the same appointments or discussed in the same breath. And, for good reason, a lot of times people are originally diagnosed with Parkinson's, but at the same time, we need to keep distinguishing ourselves as our own unique community. But I think there's a lot of opportunities for, as we have done, partnering with Parkinson's Foundation, with Michael J. Fox Foundation, with Association for Frontotemporal Degeneration and Lewy Body Dementia Association. So, where we can find these overlaps and similarities, and then really harness those to have a more powerful voice too.
And something with the larger organizations is we all have the same mission. We're all trying to support people with neurodegenerative conditions that don't have a cure. And so at the end of the day, I think, to Jessica's point, we all partner together and really support each other. And when there's advancements in research for one disease, we all celebrate. And so I've always really enjoyed that camaraderie that exists among organizations like ours and others. Yeah, other organizations have been nothing but just so supportive and gracious, and we're so grateful for their partnerships.
And so you work on creating educational resources, which is, I feel like, such a crucial role for our community, especially when there's such a big gap in like just available information. And like, what have you found when you're actually talking with community members? What are those biggest gaps in information that they're experiencing?
A major gap that we're always trying to fill and we're working towards continuously is language barriers, people who don't speak English as a first language, thinking about accessibility in terms of, we really recently created audiobooks because vision is a symptom of PSP. It's also just, accessible generally because not everyone has, the visual ability to read something or just prefers, honestly, audiobooks. Another thing that I am pretty passionate about, as well as my team, is making sure that people who don't have access to our centers of care due to location or financial ability can get quality care. So that's a major gap that, while isn't necessarily filled by educational resources, can be filled with knowing that there are specialists who treat these diagnoses, even if they aren't in their specific area.
To add to that, we noticed pretty early on that while the majority of our resources were created with people diagnosed and families in mind, they're really good at, and because they were sort of forced to, educating their own healthcare professionals about their diagnosis, which is, again, a very unique aspect of living with this. Like, can you imagine having a diagnosis that perhaps your physical therapist hasn't heard of, or that you're having to say, here's how you treat me? But they're really good at advocating for themselves in that respect. And so they would take our Some Answers booklets and go to their physical therapist or primary care doctor and say, read this so that you can understand my CBD diagnosis. And so we've tried to create a lot of our resources in a way that, is fitting for no matter the audience. And then also building our resources for healthcare professionals so that if someone wants to learn more, there are opportunities for you that are specifically for you.
As you mentioned, creating, materials for healthcare providers is so crucial. I also like to joke with community members that like they're more knowledgeable than their doctors, which like sometimes is kind of true, but
it's often true, which is so wild.
I know. Are there any like key messages or just key points that you're trying to get across to healthcare providers about these diseases when you're making those resources? Any themes that stick out? Because I think kind of more generally, just that could kind of apply to just like spreading awareness more generally.
Yeah, I think it also depends on the healthcare professional, because people with PSP, CBD, and MSA can see a variety of them. And when we create educational materials for healthcare professionals, target a little bit specifically to them. For instance, we have what's called our Allied Health brochure that focuses on specific rehabilitation professionals. So we have a physical therapy section that gives specific guidance on treatment for people with PSP, CBD, and MSA, and how they can help create exercises and programs for them that are beneficial for their specific symptom management. Whereas for speech language pathologists, that looks a little bit different because it's such a specific guideline for them. While we don't have any best practices or evidence-based practices, people just with lived experience, clinicians with lived experience, just can provide really specific and tangible guidance for people who are practicing that aren't familiar with these diagnoses.
And to add to that, I would say some of the key messages that I like to share with healthcare professionals is that we can So one of the challenges with these diseases, because they're more rare and there's not as much research going on for them as there is for some other diseases, we don't have the breadth of what we call evidence-based practice for therapies and treatments like we have for Parkinson's or other more common neurological diagnoses. But that doesn't mean that there aren't things that we can do to improve quality of care, to improve quality of life, or that there aren't best practices for these diseases. And so messages that I share are like, we can learn a lot from or draw from Parkinson's disease from your toolbox that you use when working with someone with Parkinson's, but you have to remember that someone sitting in front of you with PSP or CBD or MSA is not Parkinson's disease. And also, regardless of the diagnosis, of course, it's important to focus on the person-centered care. So, every person is going to have their own challenges, their own goals, their own priorities, and we need to tailor the care that we're providing to that person in front of you, while also knowing that it's unique, while also knowing there are things we can learn from these other diseases. We can't just have these cookie cutter models across, the Parkinsonian diseases, I suppose.
Jessica, I want to ask you about centers of care. And you mentioned kind of tailoring care to a specific person because no two people's situations are the same. How do you feel about palliative care? Because I've talked to, we're going to get into the Centers of Care Network, but a lot of the directors there are really big advocates of palliative care. And I personally think it's just like a very compelling and necessary approach to care for our community.
Yeah, well, I'll take a step back for a second and just sort of explain why you're asking that, perhaps because I think I've seen the field change a lot in my 10 plus years in this field of like how we talk about palliative care, how we approach that as a model with the neurodegenerative disease community. A lot of this has been led by first it was cancer and then like ALS and then Parkinson's disease. And I think we're just in the very beginnings of what this looks like for people with PSP, CBD, or MSA. But there's still a lot of stigma. There's a lot of misunderstandings around even just that term. So it is a model of care that is focused on someone's dignity and comfort, regardless of how much time they might have left to live. So it's really for people, this should be applied for anybody, but it's really for people with serious or chronic illness or medical conditions to just try to have them live the best quality of life possible. Here in the United States, there's also hospice care, where it's the palliative model of care applied to people who are thought to have, determined by a doctor, thought to have 6 months or less to live. And that was kind of an arbitrary number that was assigned by the Centers for Medicare and Medicaid a really long time ago. And so because of that, and because of the evolution of the palliative care field coming from cancer, a lot of times people equate these two, palliative care and hospice. Therefore, palliative care must mean somebody is dying. And that is not the case. It is just meant to be this model of care focused on dignity and quality of life. And that should start from day one for anyone with a chronic and progressive disease, but especially one that is so complex and as quickly progressive as these diseases that we're talking about. You shouldn't wait to apply palliative care till someone is thought to have 6 months or less to live. So that is an increasing conversation within the centers of care of how they can really be leaders in understanding what the application of that model looks like and how to provide that kind of care, whether you are a trained palliative care specialist or you're a neurologist who might or might not have a palliative care background, but at the end of the day, you're still providing palliative care because we don't have cures for these diseases. We're just tailoring treatments and therapies to help someone manage their symptoms and live better. So how can we think about these diseases or the care for these diseases a little bit better from day one. And I think that starts in how we share a diagnosis with somebody. That can really lay the groundwork for how someone understands and approaches their disease. And then also continuing to come back to what is someone's goals, what are someone's primary concerns and needs, and how do we help someone prepare for the future and make some of these more difficult decisions earlier on so that it's not so much that whack-a-mole, when some of these challenges might pop up down the road.
Yeah, the centers of care, if not providing, direct palliative care, they're providing really important specialized care and resources to people. And just curious if there's like anything that you've learned from centers that have done particularly well, and how you can kind of spread that across other centers and across the centers of care network.
I'll back up and I'll say, for those who might be listening to this podcast who are not necessarily familiar with the centers of care, at this time, we are 38 medical centers across the United States and Canada. So that's 34 in the US, 4 in Canada. This was established back in 2017, but really has grown a lot in the last 4 years since I joined this team, and is really more of a very engaged and cohesive network at this point. We're continuing to expand. We also know that they're not available in every single area. And we know that just because someone might not have access to a center of care doesn't necessarily mean they can't get, the right care in their area. Anyway, I really view the centers of care, which I have the honor and privilege to lead here, as true thought leaders in specialized and comprehensive care for PSP, CBD, and MSA. Something that I have really appreciated about the centers as I've gotten to know all of them over these past 4 years, although honestly I knew many of them before, is that they have a really good finger on the pulse of their communities. So like, what is their catchment area? Who is coming to their centers locally? And for many of them, especially those in more rural areas, it's an even wider catchment area. Who's going to the University of Utah versus Mayo Clinic versus Columbia looks very different, but they seem to know who is their community and what their needs are. And then they're also really good at getting very creative and using the resources at their disposal within their team, their institution, their community to address those needs that they've identified. Something that has really excited me about the centers of care over the past 4 years too is that they're all very motivated to learn what other centers are doing. The number one question that I get from center of care teams when I visit them, are we doing what other centers are doing? What has worked at other centers? Tell me what the other centers are doing. They don't want to operate in silos. They truly want to figure out what are the best practices for care for this community? What will make the most impact in diagnosis and symptom management and outreach and research? What has worked and not worked elsewhere that we can apply here? So I really try to capitalize that and foster the cohesion and collaboration and the sharing of those best practices across the network in a variety of ways.
Well, I want to ask you quickly, I know that they can just be tough for people to even get access to centers of care. Is that true or not?
One of the biggest challenges that I find, and this is not necessarily having to do with our community or our centers, but just largely across subspecialty medical care, is very long waiting times. Mm-hmm. And so this is something that I'm constantly coming back to in the centers of care and is being brought up from community members a lot. This is frustrating no matter what, even to me personally. When I have a medical thing going on and I call my primary care provider and they're like, sure, we can get you in 4 months from now. And I'm like, but I'm having this thing today. That's really, really hard. But when you're living with something that is very quickly progressive and things are changing very fast, and it's very scary, or you haven't gotten the right diagnosis or what have you, being told, sure, we can get you in with a neurologist who understands that diagnosis in 8 months from now, that can be not just devastating, but a matter of life and death sometimes. So this is really central to our conversations in the centers of care, where I'm trying to have centers think differently about how they're triaging referrals and setting appointment times for this, because these diseases are getting lost within the more common ones, which can probably wait a little, still frustrating, but wait a little bit longer to be seen. But if you take another quickly progressive disease like ALS, for example, it's very rare to have someone be told, oh, you have ALS, we'll see you in a year from now. But why is that sort of standard of care, best practices with other diseases? So how can we look at these diseases a little bit differently and improve at least that kind of access, in addition to things like better outreach to underserved and marginalized communities is another access to care challenge that we're trying to tackle in the centers of care as well.
Switching gears a little bit to Kelsey, I want to ask you about the support groups. So yeah, I feel like our support groups, as you mentioned, they're not just like a community aspect, but there's like a real educational value to them. What are you hearing from group participants that they find most valuable, or that that they just take away from those meetings?
Yeah, I think our support groups are such a special piece of the CurePSP puzzle, and why we're continuing to add new ones and new topics, and more days of the month that they meet, because they really just provide a sense of course, community, of course, knowing that you're not alone, and that sense that you belong, and that your day to day, even though it might just be you or you and your care partner, or perhaps a child living with you, that those days, can seem pretty, I think, monotonous a little bit with one of these diagnoses, the different challenges. You kind of get into a nice routine and you're feeling good about what's going on. And then all of a sudden, perhaps a fall happens and you're like, why is this happening to me? And you really, there's some big challenges that come there. And so then having a space, but what I have to look forward to is at 3:00 today, I have my care partners of people with PSP group, and I can share this tough experience that happened. And it's not something that someone, your neighbor is going to quite understand as much, because then someone across the screen or in person from you might say, hey, I had that same experience too. And really just that being able to share that, even though the days are tough, there are other people out there who are living a life, with you. And then we also try to really encourage positivity. And I think that, of course, comes naturally. People are just, even with this tough diagnosis that they've been given, there's so much to appreciate in life, and that they have this time with their family. They have more tough conversations that they can talk about and encourage other people to have in these groups. And so there's really just so many benefits to the groups, and connection is key. And I also want to highlight our peer supporters, which some people might not quite understand what those two words together mean. A support group is a little bit more self-explanatory. And so our peer supporters are people who have direct experience. They're either people diagnosed themselves, care partners. So they might be a spouse, a child, a friend who has this direct experience with PSP, CBD, or MSA. And they themselves offer their phone and email to the rest of the community. And they say, hey, you can pick up the phone, you can text me and ask a question, and we can make a one-on-one personal connection. Of course, a support group might not be the right place for everyone. Maybe you don't want to speak up in a group, or maybe just, not the right time or day to join. But the peer supporters are such a wonderful piece of our community. And I just so appreciate the people who volunteer to be on that list for many years, and offer that deep one-on-one connection with others.
Yeah, how does it inform your strategy, overseeing the support group network, when there's so many people like the peer supporters, support group leaders, who really they're really just so invested, and they really understand it like no one else. So I feel like there's just a certain connection that they have between each other that, kind of ties them in a different way that you really can't understand unless you've gone through this.
Yeah, they really care. That's something that I deeply appreciate is the level of care and love for the community that they received, a lot of them when they were maybe going through the diagnosis themselves and then want to give back. But, they just really, there's such a deep level of how can I help? And that it's such a tangible way for them to help. One, by being a support group leader, having that monthly set time to give back, and also the peer supporters of just that one-on-one, one-on-one connections are so special. And I think having those, the follow-up, the care. And then we also meet with, as CurePSP, we host an every other month. And actually every month there's 2 different sessions for volunteers to kind of come together and talk to each other and talk to us. We call it Support Society, which is more so for the support group leaders. This is like a forum discussion. And then Office Hour is where CurePSP, we let our volunteers know of new resources, new happenings at CurePSP. We always have a different team member join. And so those are wonderful check-ins for us to hear from our volunteers again, and for us to give back and reach out to them. And one last thing I'll say is just how much our volunteers and group leaders inform what we do. We have this array of support groups that we offer, people with PSP, women care partners of people with PSP, CBD, and MSA, really so many of them. And one of our volunteers noticed that there wasn't one specifically for people with CBD. And so we made one. And that really it just informs us and continues to grow our educational and support offerings, including, one that recently started that's for care partners of people with PSP with FTD behaviors that we're doing in partnership with the AFTD Association. And so it's really, we're just continuing to expand. And sometimes it's not even us at CurePSP that initiate those, it's those dedicated volunteers.
Yeah, I want to talk about the quality of life respite grant program. That's another invaluable resource that we offer that I wish we could, as I bet you do, wish that we could offer to even more families. But I want to know, just to start, what does quality of life mean to families? And does it differ based on what disease stage they're at?
That's a great question. Quality of life to me means that people are not only living, but learning how to thrive each day in the face of a progressive illness. And I think that it absolutely does shift depending on how far along in the progression you are. I think the term quality of life continues to change as long as somebody might be living with or caring for somebody with one of these diagnoses. The Quality of Life Respite Grant Program is specifically designed to help keep those who have been diagnosed at home so that families feel supported in the decision to care for their loved ones at home instead of needing to place them in an assisted living facility. Although that might make sense for some families, many of our community members, if it's available to them, want to keep the care centered at home. And I think that this helps to increase quality of life in general because it allows people to stay at home longer and more comfortably with the support that the respite grant can provide. It is currently a 100-hour respite grant program. This year, we're going to be awarding more grants to more families than ever before. So this is really exciting.
Yeah, no, it is really cool that it's expanding over time. And how do you measure the impact of the respite funding? And what feedback have you heard from recipients?
Sure. Well, measuring the impact, just statistically, how many hours of care are we able to provide per year? How many families are we able to impact? What kind of care are they receiving? What's that level of care like? Are they appreciating the agencies they're working with? How has this impacted their lives? How has this impacted their quality of life of not only the care partners or the folks who have been diagnosed, but also the rest of their support networks and family members? I think we're constantly figuring out ways to measure the impact differently. But right now, as I mentioned, it's 100 hours to be used with an in-home care agency of a family's choice. And we want to, really place the power in the hands of those who are living with the diagnosis to make sure that they're getting the care that they deserve. And So that's one way that we're able to measure the impact. And we do collect a lot of testimonials from families to make sure that we are hitting our marks, to make sure that the agencies that we're recommending and partnering with are helping to increase the quality of life and not add more stress to the plates of those living with or caring for somebody with PSP, CBD, or MSA.
Yeah, and I want to kind of know, you've been at CurePSP, as you mentioned, for almost 10 years. What has it been like for you to kind of track just the progress of the organization over that time?
Yeah. In the last 9.5 years, I think there has been an incredible increase in awareness around PSP, CBD, and MSA. I think there's been an incredible awareness. I think the amount of healthcare professionals that are reaching out to us, it has increased tenfold. The amount of families that are calling us looking for educational information or looking for respite grants, looking to get involved with clinical trials, everything has increased tenfold. And when I started, there were 6 people on the staff, and now there's 20 and soon to be more. So I'd say that's a pretty impressive, measuring of the way that it's progressed.
Yeah, absolutely. Courtney, I want to ask you a little bit about awareness. So we kind of mentioned a bit about access to information is a big barrier for certain communities, certain groups of people. How do you reach underrepresented communities that might be struggling with, just even receiving the information that we have available?
Great question. It's a long game, to be honest. I think the first step is figuring out where we can tackle. So earlier I had mentioned language. That's absolutely something that we can kind of reach out to folks. We are in the midst of translating our resources into Spanish and French, and we'll expand from there. And so making sure that people who, as I said, don't speak English or don't speak English as their primary language or just prefer, a different language, that they have access to this information because they may not in their preferred language. Yeah, another aspect that we all at CurePSP always think about is geographic location. So people in rural areas might not have access just geographically to those higher levels of care that are at our academic centers, like the centers of care. So making sure that people have access to the educational resources to educate maybe a general neurologist that's in their area that they have access to and isn't a super long drive or a flight away, making sure that they can provide information to them to get the best care possible. Another is just socioeconomic status, which is where Joanna really comes into play with her work on the respite grant, making sure that people have access to safe, quality care that not only keeps people healthy at home, but living a life that feels meaningful to them. Oh, I want to say one more thing, sorry. We also have to think about, earlier, as I mentioned, accessibility. People have different abilities, whether that's related to PSP, CBD, MSA, or just other disabilities in life. And so we want to make sure that people can read, listen to, and access our materials and our resources and programs and webinars, regardless of those factors.
I want to talk a bit about advocacy. Obviously, advocacy is a big topic. Jessica, we've had an advocacy episode in the past. We'll probably have more in the future, but I just want to mention it a little bit. These diseases force people to become advocates for themselves. And if you just could give maybe like a brief little update on what the latest advocacy news is from CurePSP.
Yeah, I think, advocacy means different things to different people. Here at CurePSP, especially with advocacy being in my title, we're really trying to recognize all these different levels of advocacy, from, as we've discussed, empowering people to be their own advocates, and that's through giving them the right information and the tools that they need in order to do that. And then also educating healthcare professionals so they can be advocates for this community and, everywhere in between, but then taking it up to the highest level of public policy and legislative advocacy. We've really been trying to build that arm of our advocacy efforts here at CurePSP over the last couple of years, and we're now at a really exciting place with it. There's been a lot going on from an advocacy standpoint that I can't even probably begin to cover right now in this, but some of the bigger things is that earlier in the spring during appropriations season, we had requested that language urging the National Institute of Neurological Disorders and Stroke, or NINDS for short, which is part of the National Institutes of Health, to specifically include PSP, CBD, and MSA in all data collection and programmatic initiatives related to neurodegenerative diseases, so that we can get more information and generate more research and awareness around those diseases specifically, where as often they're lost, as we've been discussing within ALS and Alzheimer's and Parkinson's disease. And we worked really hard to have these follow-up meetings with different key congressional offices on the Hill, and really excited that as of a week and a half ago, we learned that the Senate Labor, Health and Human Services did include our appropriations request in language in their report. So that was huge. And now we're waiting to see what happens on the House side of things. Earlier this year, we formed an advocacy steering committee that's really guiding the crafting of our legislative and public policy agenda. And then that will create more opportunities to inform and mobilize our community. We're working really hard to build more relationships on the Hill, especially with key offices that were involved in the passage of the National Plan to End Parkinson's Act last year, or have otherwise identified themselves as having an interest in neurological disease and rare diseases. And we're also trying to build more relationships with federal agencies. So there'll be a lot more to come. There's a lot more that I could say, but I definitely urge anyone who's listening to follow us on social media. If you have social media, to sign up for our e-newsletter, which comes out monthly, and to visit psp.org/advocacy in order to stay up to date and tap into these different opportunities that'll be coming out to get more involved in advocacy efforts.
Lastly, I want to end on a slightly more wholesome note. So you all obviously provide absolutely crucial, direct communication with our community members. And if anyone just had like a story or a moment that sticks out to you from your work with community members that sticks with you, something that, captures, why you do this work.
I don't know if I have one specific story that sticks out in my mind, but rather sort of a general feeling about when I think about all of the thousands of phone calls that I've participated in with community members over the last years that I've been with CurePSP. We're not talking about easy topics. We're on the other end of the line. We know that there's somebody who's having a really difficult moment, and we recognize that them picking up the phone and calling CurePSP, they're taking a step towards educating themselves, advocating for themselves so that they can be better prepared for the journey that lies ahead. So I don't know if it's one particular thing, but when I think about the conversations and opportunities that I've had to connect, it allows us to have a real human connection, a moment where we're talking about living well and facing the inevitable, which is that at the end of the day, we're not all going to be here. And how do we thrive? How do we support each other and make a meaningful connection along the way? So that's what I have to share.
An example from me is our Ask the Expert webinars, which originates from this team, Kelsey, Joanna, and Jessica, and we kind of brainstorm topics that people have been asking about. And every single time we host an Ask the Expert, no matter what the topic, the feedback we get is just, this is so helpful to the expert. Thank you so much for sharing this information. And really, my work there is just connecting the expert to the people. I'm just kind of the conduit, but it feels really good to know that when PCA works together, we can really target the right person to the right audience. And we're making their lives a little bit easier by providing them with the tools. Of course, they have to go and act for themselves during this difficult time, but to know that we can make their lives a little easier is really powerful.
I definitely second what Joanna was saying about the connections, especially over the phone. Those are such special, personal, deeply personal conversations that we have with people. And it's really a big part of why we do what we do. Also, something that comes to mind for me is there are oftentimes community members reach out via email, via phone call. We have different conversations. I'll see them virtually on support groups. And then there's those really special moments where we have an in-person event and we get to meet and actually hug each other. And there's one specific person that comes to mind, Eugenia, who is a wonderful volunteer, has been on this podcast before, I believe, and is a just volunteer, also diagnosed with CBD, and just is a great part of our community. And I remember the first phone call we ever had that lasted about an hour, and we chatted and talked, and finally we got to meet 3 years later in Detroit, Michigan. And I consider her a friend, and there's so many people like that in our community that it spans so much more beyond work. And I really appreciate the hearts that people bring every day to be able to connect and be vulnerable and share highs and lows with each other. So it's a privilege.
And for me, I wouldn't be here in my job if it wasn't for this couple that I knew back when I was at UNC, Pierre and Jocelyn, where I knew Pierre from early symptoms to being diagnosed with Parkinson's, to it switching to PSP, to him and his wife saying, why is there no one who's ever heard of this? Why is there no support group? And they started a support group, and they reached out to CurePSP, and we started creating programs and resources together. And then I knew him through his disease journey, through end of life, through brain donation, and maintained a connection with Jocelyn years later, who is still a peer supporter for us. So they saw that need, not just for them, but for other people with this disease. And they took some steps and they changed it. And now that support group, whatever it is, like 9 years, 10 years later, is still going strong in North Carolina. And I can name so many examples like that. But for me, more broadly, it's just this, I've known so many people now who I've seen go through the symptoms, through end of life and beyond, and everything in between. And it's just an honor to walk alongside them. And it reminds me every day of how this community, as hard as some of this stuff might be, they smile and they find joy and they find connection and they persevere. And they're looking to us as partners and as advocates. And that's why we're doing what we're doing.
Thank you to Jessica, Courtney, Kelsey, and Joanna for sharing their insights and the incredible work they're doing through our PCA team. The programs and resources they've developed are making a real difference in reducing isolation and providing both practical support and hope. If you enjoyed this episode, be sure to follow and rate us on Apple Podcasts, Spotify, Amazon Music, or wherever else you get your podcasts. You can find links to CurePSP's support groups, educational resources, and advocacy efforts in our episode description. I'm your host, Oscar Sullivan. Talk to you again soon.